now to outline the declaration, a joint declaration for a European framework for obesity national plans within the NCD framework. And all of these words absolutely carry some gravitas with them, and I'll explain why as we go. So there are a few baseline elements that we need to clear up. Now, during the whole registration process, we actually received, as you'll see, over 100 different questions from all of you. Wanting to know what was in the declaration, what could be in the declaration, what was really needed. And some of you also posed the question, since when is even a disease? Well, 1948 is when the WHO, since
Dear Jacqueline,
ICD...
So Jacqueline, sorry to interrupt. Mm-hmm. Can you hear me?
Yeah.
You have to share your screen. You're not sharing your screen at this point.
Okay, let me try again.
It's fine.
Yeah?
Yes.
Okay. So 1948, when the World Health Organization categorized or classified obesity as a metabolic disease in the International Disease Classification Index. So, the latest version in 2021, overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. This is key for the simple reason that and we'll see this a bit later, it's how we actually choose to implement obesity and everything that goes from it. 2021, the European Commission updated and built on this, saying pre-obesity, brackets overweight, and obesity are medical conditions marked by an abnormal and or excessive accumulation of body fat that presents a risk to health. Obesity is a chronic relapsing disease, which in turn acts as a gateway to a range of other non-communicable diseases, such as diabetes, cardiovascular diseases, and cancer. These are not empty political statements. These are all based on facts and scientific as well consensus. Now, very recently, as of January 1st this year, after 30 years, the International Classification of Disease Index was updated, and the obesity description is now very clear. Here, I would just highlight obesity is a chronic, complex disease. So essentially, there's a lot in, I would say, policy terminology to say we not only have scientific evidence to this effect, but that evidence has already been transposed, as it were, into a legal basis to act. And this is really key because the World Health Organization also defines a chronic disease and chronic disease management as ongoing management of conditions over a period of years and decades. So when you're able to actually take the, should we say, scientifically accurate and precise and embedded definition, it starts to make sense. Because then we start to think in terms of other NCDs where we have screening programs, early diagnosis, treatment, long-term management. Because whatever the size one happens to be, once someone starts having obesity, it's lifelong. It comes in many shapes, shades, and sizes, but it's lifelong. So I'm not going to repeat the Commission's statements last year, but what I will say is there have been ramifications. Now, the latest is that on the 15th of December last year, just before the Christmas break, the Healthier Together EU Non-Communicable Diseases Initiative was launched by the Commission. Tick, we were so happy thinking obesity is already in there. The aim is to help member states reduce the burden of non-communicable diseases. Duration 2022 to 2027. Actually, that's very good as it transpires, because the published original scope has been to, as you can see, produce disease-specific NCD roadmaps for cardiovascular, diabetes, chronic respiratory diseases, and mental health, all of which are obesity acts as a gateway chronic disease. And yet, obesity has been left in health determinants and not even, but we'll come to that later. So very briefly, why all this fuss? Firstly, we were told, well, we've been addressing obesity. Have we really? And then the second point which was made was, well, don't get so hung up on having your own plan. Think how we can get through in terms of treatment and long-term management of obesity by maybe hanging it on to something else. Finish the sentence, a bit more serious. So essentially, we started thinking collectively, well, what would it mean? Why do we want to have such a plan, not just in paper, but implemented as well? So essentially, it provides a clear and comprehensive picture, a continuation, and a logical step of a policy statement or policy. It gives us a set of parameters to actually solve known issues. Why it's useful? We all talk about roadmaps. We all talk about measurements, certainly within the European Union context. We don't have that for obesity. We have snapshots of BMI at any given time. We actually have no sense of framing how this chronic disease works and how to address for better health outcomes. We don't have any targets and indicators apart from prevalence via BMI, which we all know is flawed. We're not able to predict, to identify, to allocate resources because we don't actually know what the extent of the problem is. Or problem, challenge, health status. We don't know how to lay the foundation for monitoring and evaluation beyond BMI. It becomes a very circular discussion. Obesity comes in many shapes and sizes. It matters to have an NCD framework because we know we need to move beyond BMI. We know what the science is. And now we have a policy level. In inverted commas, legal basis. So 3 phases, 5 countries, over 100 stakeholders, very lively discussions. We voted a couple of days ago on all of this. Cross-cutting issues came up which need to be able to be there to actually help the implementation as an enabler to implement national plans. So underlying infrastructures, many of you will already have attended our European Health Data Space event in January that talks a lot about this in terms of allowing interoperability across geographies and related complications or precursor medical conditions. There are over 230 medical complications of obesity. There needs to be some kind of interoperability, ensuring that treatment pathway guidelines are in place, but not just in place, because we have many treatment guidelines right now, but actually implemented in law, monitored, measured, and evaluated, just like we do for the other major NCDs, to ensure that there's primary and secondary data capture, and that actually we can evaluate data to help treatment options and shared decision making. This is not about one stakeholder or other. This is about better health outcomes. So another cross-cutting element, of course, will be funding mechanisms. We're advocating collectively to base those funding mechanisms more on an approach of health outcomes. Because if we continue in the various silos of, well, this pathology or that pathology in terms of cardiovascular, in terms of diabetes, we will never, ever actually get to the root cause, and we will never actually have the resources across the board to finance this in a stepwise approach. Therefore, we're advocating for to ensure that funding instruments are in place, and also, taking into account national competencies and, should we say, means to act. That we need to actually consider which health technology assessment and reimbursement principles can actually be implemented in a stepwise approach within national plans on obesity. Education. So not just medical education, but actually for everybody. So education in terms of mandatory integration of obesity, both at basic medical education as well as more advanced. Primary care healthcare professionals raised their hands. We need to know more how to diagnose, treat, support management. Also, on the other side, public awareness campaigns, which goes hand in hand with health literacy. How do you know you even have a chronic disease unless you know, and how do you actually understand what are in your medical notes unless you understand your health condition? Early diagnosis, uptake of ICD-11 chapters on obesity. How are we able to support all of that? So establishment of obesity screening programs and related guidelines, broadening the set of obesity diagnosis tools, moving beyond BMI. Think about all of those other early diagnostics from the lab, blood tests, insulin resistance, leptin, ghrelin, all of these things, which are already in existence. We're not thinking about how we can actually better the toolkit for early diagnosis because we're only thinking BMI. Treatment components. It's very easy. There's no one single form of obesity. We are advocating for access to a full portfolio of appropriate physiological and psychological treatment options, regularly updated and referenced evidence-based clinical guidelines, and of course, an infrastructure that allows multidisciplinary centers of excellence, such as, of course, EASO, for instance, has over 136 collaborating obesity management centers across WHO Europe. Why are we not even thinking about those currently? Why? Because we're not having the discussion and we don't have that sort of a framework. Also, EU accredited reference networks. So on obesity treatment and long-term management, which are interconnected with other reference networks, such as for diabetes or cancer or cardiovascular diseases, all of which are currently on the table for the complications for obesity. And of course, let's not forget registries on the table again for all NCDs apart from obesity. Then we get into long-term management components. Now here, it would be a fallacy to pretend that just because someone happens to get their weight under control, that their obesity disappears. Remember the definition: abnormally functioning and or excessive fat accumulation. So there's a real need to have a multidisciplinary case management infrastructures all the way through. And that doesn't start or stop at a dietitian. It's about having an appropriately assigned specialist, psychotherapist, physiotherapist, endocrinologist, dermatologist, anyone who is related to the long-term management of the biology and the psychology. And then, of course, there's regularly supported self-management, which was a big discussion because we have to sit there and say, what exactly do we mean by self-management? It's not one person or the other. This is about the health system and the medical team helping, supporting, and, we might also say, also non-health actors, making sure that the relevant tools are there for when the person living with obesity and their carers, their friends, their family, their workplace are not under medical supervision, but something which is interconnected back. So medical grade data that can actually support co-decision and partnering in health of the person living with obesity. And of course, complementary services that support quality of life. Almost finished. What's the timeline for all of this? Well, or even pathway, because to be frank, we don't have a timeline. And I know, we're looking forward to that discussion today to start putting that timeline in place because officially we've got till 2027. Not really. At the moment, Healthier Together is 2 years worth of planning, neither of which currently have an NCD roadmap specifically for obesity. Let me be clear, health determinants is not obesity. So what we would like to ask for within this declaration, given that most national member states are already developing their own national plans on obesity, EU needs to catch up, to designate 2023 round of NCD roadmaps to develop the one for obesity. And the final element of all of this is to call on representatives from EU member states, of course, and particularly the European Commission's high-level steering group on NCD promotion, prevention, treatment and management to actually open the dialogue on having an NCD roadmap specifically for obesity. Because just as with other NCDs, we can't do this on our own. We've been told in the corridors very clearly, member states have to act. Great. Member states do have to act, but we also need to know who is representing us in all of this so that we can actually open that dialogue and work together across different stakeholder groups, cross-border, as well as within our respective member states. Thank you. And I do believe I'm handing back